Good evening, everyone, and welcome to the special live radio show with Dr. Amar Katranji. Dr. Katranji is a board certified periodontist with Nemeth and Katranji Periodontics in Southfield, Michigan. He specializes in oral health and reconstruction with respect to dental implants. He has a reputation for being one of the area's foremost experts in handling complex implant issues. Dr. Katranji will talk to us about the importance of getting the correct diagnosis and making the right decision before moving forward with periodontal care. He's joining us tonight in this rare opportunity to call in and speak with the doctor directly. You won't want to miss what Dr. Katranji has to say. And if you have a question for the doctor, we're inviting you to call at 800-859-0957. So stay tuned. We'll be right back after this short break. You're listening to News Talk 760 WJR.
This is really loud.
What?
Is there a way to bring this down a little?
Turn the volume
Yeah,
down?
it's really loud.
You want to go run in and tell him to turn it down? Um, yeah, okay, never mind.
I think you
Beth
got
will
it.
tell him. The seminar was in LA, was it?
It was in Los Angeles. Yep.
Yeah. Oh, does he have times?
Yeah, I have my times.
You've got the times?
Yeah. Thank you. Yeah, that's much better. Thank you.
Is it okay now?
Much better.
Welcome to the special live radio show where you can call in with your questions and talk to the doctor directly. I'm your host, Anne Marie Cronin, and we're here tonight talking with Dr. Amar Katranji, board certified periodontist in Southfield, Michigan. Dr. Katranji is here with us discussing his state of the art clinic and the latest treatments in periodontic care. And he'll be explaining the advanced technology and progressive surgical techniques he uses in helping his patients to achieve the best results possible. If you have a question for the doctor, please call us at 800-859-0957. Dr. Katranji, welcome to the show. We're very happy to have you here. And I understand you've just come back from LA, from the North American Society of Periodontics. What is it that listeners need to know? What's the latest news?
Well, thank you very much for having me. I mean, one of the things that we learned at the meeting in Los Angeles, and this meeting brings together 50 of kind of the leading practices in the United States, and we discuss different therapies, things that are working, and things that we can do better. One very interesting thing that came out, we had a lecture from Ohio State University about the prescribing of antibiotics in dental practices and how in many cases we're over prescribing antibiotics to our patients. And in some cases, we're removing the ability for patients to have antibiotics for other procedures because in every situation at a dental practice, sometimes the norm is to just give an antibiotic, whether they need it or not. And so one of the take back messages, the messages that we're bringing back is we're only going to use antibiotics when it's absolutely necessary. No longer are we just going to give antibiotics for somebody who comes in for routine care or for a simple procedure, because the evidence just doesn't support it anymore. And we're going to protect our patients by allowing them to have those antibiotics for other more important procedures. So,
That's very interesting because I'm just thinking on my own dentist and going for dental visits where they're doing procedures and the standard was always I'm sending you a prescription, go to your pharmacist, pick up antibiotics, start taking them, for 2 or 3 days before you come in. So now what you're saying is proceed with caution.
well, yeah, absolutely. If you have an infection, absolutely you need an antibiotic. That's what the antibiotic is going to do for you. It's going to protect you from bacteria. Now, if you have a simple procedure and there's no bacteria involved, we shouldn't be giving antibiotics. And one of the nice things about this was looking around and looking at the research. There's no indication for, routine care if you're going in for a filling or if you're going in even for an extraction. If there's no infection, there's no reason for us to be giving a 10-day dose of antibiotics. And we've also learned to stay away from certain antibiotics like clindamycin. Clindamycin can create certain infections in the stomach that can cause issues that really can only be resolved in a hospital setting. So we're removing certain antibiotics from our regimen, from our plan that we give patients, and we're going to proceed now with caution and be very, very mindful of when we're actually prescribing certain antibiotics.
Well, you certainly are up to date on everything in your field, but for the average listener out there who obviously is going to see their dentist on a regular basis, what is it that leads a person to be referred on to a periodontist? What exactly is your specialty all about?
That's a great question. So periodontology is the study of a chronic infection that occurs in the mouth. So many times when we're eating, when we go home and we have a sandwich or something, if we don't do a very good job, if we're not vigilant in removing the plaque that accumulates around our teeth, what'll happen is bacteria will start to surround the tooth and find its way into a pocket. And if it's not removed, that bacteria slowly evolves and creates a chronic infection. The bacteria that then evolves over time is an anaerobic bacteria. If you can imagine the environment inside a pocket, there's no oxygen. There's nothing in there
Right,
to protect you from that
right.
bacteria. And eventually that bacteria invades the tissue. So the supporting structures, everything around the tooth starts to break down. And in some cases, we start to see tooth loss. So for patients who might say, well, I don't have a problem, I don't feel anything, what we usually call periodontal disease is the quiet disease because nobody really feels it. There's no pain. There's nothing that really indicates that you have periodontal disease. Maybe some bleeding when you're brushing and flossing, maybe some bad breath. But then all of a sudden, you might start to say, oh, some of my teeth are loose. I'm having a harder time eating. And then tooth loss starts to emerge. So, periodontal disease is the number one cause for tooth loss. And that's another aspect of what a periodontist does is replacing the teeth. We actually replace teeth after they're lost.
Let's talk a little bit about tooth replacement. I know there are a lot of people advertise on television. There's a lot of ads going around about you can get it done in 1 day. If patients, listeners start noticing that they have, especially if it's front teeth, I would imagine
Mhm.
everybody's would be worried about not losing teeth that are in the front for obvious cosmetic reasons. What should the average patient do? I mean, are they supposed to find their own periodontist or how do
Well,
they get to you?
Well, honestly, the most important thing is finding an accredited surgeon. A periodontist is somebody who goes through advanced training 3 years after dental school to treat and learn all about periodontics or periodontology, and then specifically infections. And on top of that, our focus is regeneration, bringing lost structure back, and in most cases when you lose a tooth, actually replacing the tooth with an implant. How do you find somebody? You can find them on the AAP, which is the American Academy of Periodontology website, and then you can look us up and come to our office, and we can do some examinations on you and see if there's something that we can do to help improve your oral health and make it so that you can maintain your teeth and replace them if necessary.
Crucial that you get to the right person at the right time and not go down the wrong pathway. Let's come back and talk about this more on the other side of the break. In the meantime, you are listening to the Dr. Katranji radio show, and the doctor is here tonight talking about the seriousness of making the right decision before embarking on periodontal care and treatment. If you have a question, you can call us at 800 859 0957. Again, that number is 800-859-0957. Don't miss this opportunity to call the doctor directly. You're listening to the Dr. Katranji radio show on News Talk 760 WJR.
Is your current home loan the right fit?
Are we on Facebook? We are. We're on Facebook Live. Okay, here we
Alright.
go. We're on Facebook Live, Dr. Katranji, and I guess we should have talked to you about this beforehand. So,
All right.
um,
Hey.
for all of the Facebook people that are tuning in on Facebook, I mean, it's great having you here because I think that a lot of people just don't even know what periodontics are all about. They just, and it was interesting during the first segment of the show. You're talking about people experiencing tooth loss. It's too bad that it wasn't prevented beforehand by the dentist telling the patient that, hey, you really need to be, cleansing your mouth at the end of the day so this bacteria doesn't take a hold on your entire oral cavity and then get, like you said, the anaerobic organisms getting in where they're once they get under the gum line, I guess it's too late.
Right. And I think that's an important thing is diagnosis. If you're seeing your general dentist and your hygienist is cleaning your teeth, it's important that they use what we call a periodontal probe. A probe is like our little ruler that goes around the tooth and measures the pockets around your teeth. And sometimes it can be a little uncomfortable, but it's a necessary part of diagnosing this type of disease. And the sooner that we get to this disease, it's a very treatable disease, but when it's treatable, the treatments don't take that much. It's literally maybe a deep cleaning. As it gets more and more progressive, the treatments become a little bit more involved, all the way to the point where you lose your tooth. And now we're talking about replacing teeth.
Well, I know when your partner, Dr. Nemeth, has been on the show before, he's talked about something. He said gums should never bleed.
Never.
And, many times when people are brushing their teeth, they might notice that there's a little bit of gum bleeding and not know anything about it because I don't think that most dentists are letting people know or saying to people, this is the time for you to take the next step and find out why are your gums bleeding because they shouldn't be bleeding at all, ever.
They should never bleed. And then when they're bleeding, it's your gums telling you. It's an SOS. It's telling you to something is going wrong. There's an
Hmm.
infection here. And like I said, many times it's a simple procedure to clean that out and stop the bleeding. But if you continue to bleed and you continue to lose tissue over time, the treatments become more involved.
Right, exactly. Well, pretty soon we'll be back on live again. Welcome back to the Dr. Amar Katranji live show. I'm your host, Anne Marie Cronin, and we are here tonight talking with Dr. Amar Katranji, board certified periodontist with Nemeth and Katranji Periodontics in Southfield, Michigan. Dr. Katranji is here with us discussing the latest treatments in periodontic care and the importance of understanding the processes involved before engaging in dental implants, gum disease, gum recession, and cosmetic procedures. If you have a question for the doctor, please call us at 800-859-0957. Dr. Katranji, over the break, we were talking about how gums should never bleed, that would be one of the first indications that you have periodontal gum disease.
Right, absolutely. The gums should never bleed. If you're brushing and flossing and you're noticing bleeding, your gums are trying to tell you something is wrong. And in those cases, it's important for you to see a periodontist, somebody who is specialized or capable of treating this gum problem. And in many cases, it's a simple fix. But if it's something that's ongoing, chronic, long term problem, then we have to go on to some things that are a little bit more aggressive in order for us to clean that out. Nowadays, we use lasers. We use quite a bit of laser treatment, and it's no longer where we're using stitches and we're cutting. It used to be a very involved procedure. With the laser, things are not so. It's not as invasive, and it creates the same sort of results that we're looking for, cleaning out the pockets, removing the bacteria, and getting a healthier periodontium, the area around your teeth.
So you're no longer cutting away, you're no longer surgically removing gum tissue in order to destroy the bacteria. You have more advanced methods now with the laser.
It's not necessary. If we have the ability to target our energy, to target our removal of tissue with this laser, then why aren't we doing that? That's what we do on a daily basis. We don't just remove here and there whatever we need to remove tissue. We remove the very specific infected tissue. And in many cases, patients are back up and running and they're living their normal life within a day or two.
Now let's move on to people that unfortunately lose their teeth
Right.
and then they're faced with, oh, I'm going to have to get, either false teeth or dental implants. How do they get to the right in the hands of the right care? I mean, that's really important because I think that once people have their teeth extracted, how do they know where to go to next?
I think it's important for you to ask questions. I think if you're at a dental office, most dentists will do what they feel they're capable of. If they're not capable of, they should refer. And if you have a situation where you don't feel comfortable, seek out a specialist. Seek out either a periodontist, somebody around your town. There's literally periodontists all over America, and they're all specialized in treating this type of situation. When you're in that care, replacing the teeth is simple, it's straightforward, it's predictable. And that's what we're trying to get to. A lot of people come to us sometimes and they're dental cripples. Imagine somebody who's been in dentures for years and years and years. And what happens is when you're wearing a denture, that denture wears away the bone. The bone is resorbing, it's dissolving underneath that denture. We have the ability to treat that. We have ability to replace that denture with a set of teeth that are fixated by implants. And this is something that can be done relatively quickly and can restore your function, your aesthetics. It can give you your life back. So finding a dentist, finding a periodontist who has that training is something that's critical as far as getting the right care and a predictable result.
Yeah, I think that's what the problem is. I mean, I'm just stopping and thinking about the people who had teeth removed and then they got bridges or they got partials or they've got, the four front teeth are somehow snapped into your face. So are you saying that those people who perhaps had that as a remedy for having lost teeth, how much time does it have to pass by where before they or how late can they wait before they would go and get your treatment for dental implants?
Well, I think when they come in, we have to establish where they're at as far as their condition. If we have a person who comes in who's been without teeth for a very long time, their treatment might take a few months. Whereas somebody who maybe just recently lost their teeth, it might be a lot easier to take care of.
Mhm.
If I'm taking the teeth out, I have the ability to do things much quicker, much more predictably than somebody who comes in after numerous procedures have been done. Now, I will tell you a lot of what we're doing nowadays is more complicated procedures. In many cases, we're fixing things that have been done previously, and that always takes more time. So,
Wait, I'm gonna stop you here. What do you mean by fixing things? What does that mean something was broken or something was done wrongly or something wasn't done properly?
so yes, unfortunately, there are many different people who do procedures, and in some cases, their training may not be as rigorous as maybe a surgical specialist like a periodontist.
Mhm.
And in many cases, bone augmentation. So when we place an implant, we want to make sure that it's stable and it's stabilized in bone. And in some cases, in order to reduce cost to patients or in an attempt to make things go easier for the doctor, sometimes things aren't done to completion the way that they should be. A gold standard would be a bone graft, then the implant if you don't have the bone. So some people don't always do that. And you might have an implant that lasts for a year or two, and then all of a sudden you start to notice it's breaking down. When it's breaking down, we're losing the bone that you already had. And now I have to grow not just the bone that you already had, but on top of that, the bone that you need for the implant. And that can take some time. So
So you're seeing patients that have had implants already that are failing?
unfortunately, yes. So
How
there
how did they fail? I mean, how did a person get into a situation where they lost teeth, they had an implant, and the implant fails?
so again, with implant therapy, there are a lot of different ways that we can place implants. And sometimes people lose a tooth, they take the tooth out and they put the implant in. And let's say that person had periodontal disease and they didn't fix the periodontal disease first.
Mm.
Well, now that implant has been placed into a site that also has a disease in it. And we actually call it peri-implant disease. So we're calling periodontal disease now peri-implant disease because it's the same bacteria, it's the same bugs. It needs to be treated first. And that doesn't always occur. And now we've lost bone, we've lost an implant, and potentially we're losing surrounding teeth.
So it's crucial then to really get into the right care immediately. I mean, I feel sorry for people who they've lost their teeth and they've tried to get an implant and for some reason or other it fails because I think most people would think that once they get that implant put in, it's in for life and it's good and nothing bad can happen.
Yeah, and dental implants in the right hands have a 98, 99% success rate. So the success rates are still the most successful dental medical procedure ever. There's nothing more successful than a dental implant placed properly. The issue now that we have sometimes is that there's overcare. So sometimes instead of saving a tooth, as a periodontist, my goal is to save a tooth. There's nothing better than saving a tooth. But when you can't save a tooth, then you go into placement of an implant. Sometimes that's not adhered to. Sometimes we're not taking the proper steps, and that's where some implants end up failing.
So patients really need to be their own advocate and make sure that they get into the right hands of the right periodontist because they can go down the wrong road.
You need to ask questions. You
Well,
need to ask
also
questions.
I think there's a lot of advertising going on about, get your teeth replaced in one day. And it doesn't mean because you're on TV that you're doing, the best job. And it's let the buyer beware.
Right, and there's so many different methods of doing things, and you know that term. There's an old saying: if all you have is a hammer, everything looks like a nail.
Right.
Some of these places that are advertising, all they have is this hammer, and everything is a nail to them. And you might go in there and you might have one or two teeth that requires extraction, but they'll convince you to remove everything. I've
Mm,
have patients that come in and see other national brands that come in and they say, I went there and they said all my teeth need to come out,
mm.
and really it's one or two teeth and they might have some periodontal disease. So it's necessary to it's necessary to ask those questions, to continue to say, is this the best treatment for me? And there are people who have the answer for you, and that's what you should seek out.
And you certainly have state of the art technology. We'll come back and talk about that on the other side of the break. In the meantime, you are listening to the Dr. Amar Katranji live radio show. We're talking about the importance of diagnosing and treating gum disease and how it can prevent some of the major diseases of our time. If you have a question, you can call the doctor directly at 800-859-0957. Again, that number is 800-859-0957. Don't miss this opportunity to talk to the doctor directly. You're listening to the Dr. Katranji radio show on News Talk 760 WJR. So we are back on Facebook Live and going into segment 4. Hi, Siobhan.
Hi, Dr. Katranji. Nice to meet you.
Hello, nice to
I'm
meet you.
Siobhan,
Hi.
occasional co-host. A little bit late today,
Well,
but it sounds very interesting what you're talking about, so I'm glad to join in.
well, welcome. Thank you. Thanks for having
Oh,
me.
thank
So
you. If you don't mind, can I pipe in with a couple questions that came in on the Facebook Live real quick
Yeah, go
while we're
ahead.
at it? Okay. So somebody says here, Sarah, I usually have to take antibiotics before my regular dental cleaning. So now I'm not supposed to take it anymore? Question mark.
So this is actually one of the topics that we had is, yes, in some cases, if you have, let's say you have a replacement hip or a replacement knee, there's a period of time where you need to have the antibiotics. But once that's done healing, the question then becomes, why are we giving you antibiotics 4 or 5 years out? And the old response was because of what we call a bacteremia. A bacteremia is when you have bacteria in the blood. That's all that it means. And the concern is when we're cleaning your teeth, well, sometimes you bleed, and that bacteria that's in that pocket gets into the blood. The issue is, or the response to that is, every time you chew and every time you brush your teeth or floss, you potentially cause a bacteremia. Does that mean you always take antibiotics when you chew and when you brush your teeth? The answer is no. So we really have to be mindful. Is there really a true risk? If there is, absolutely take it. And that's where we have to, as a profession, make a decision and say, okay, I know what's good for my patient. I know what's happening in their mouth. do I need to protect my patient from bacteria that might not actually be, that bad for my patient?
Okay. We have another question too. It says, it seems like most, this is from Beth. It seems like most dentists and periodontists still do the old cut and sew procedures to treat gum infection. Why don't more do it your way? It seems so much less painful and much easier.
So the treatment with the laser requires more advanced training. So there's another a hurdle for a dentist or a periodontist. Sometimes there's less that go through that education and that process. The Right now the literature and the science is very sound. We know that the laser works. We know that we're getting a response that's creating a healthy environment, and in our practice, it's the gold standard. It makes a lot more sense for patients to go through less trauma, less removal of tissue, and overall better experience and get a really tremendous result.
Yeah, it's
Okay.
interesting about all the stuff that is going on in that office. I mean, you guys have got like a state of the art. I don't know that there's anyone that's got the technology that you've got. There just isn't comparable offices like this.
No, I mean, I'm blessed. I get to work with Dr. Nemeth, and I think we have a mindset that we're never satisfied. If there's something better, we reserve the right to change our mind. If we have something that proves to be a better, a better product, a better solution for our patients, we're absolutely going to do it. So, sometimes it takes a little bit of a leap, but we definitely do our research, and we're always looking for a better way of doing things.
Yeah, it's just patients need to connect the dots and realize that they're their own advocate. And
Absolutely.
it's not that easy to find the right road, to get to the right doctor or the right periodontist. So it looks like we're back on in a minute or two.
Hmm.
Welcome back to this special edition of the Dr. Katranji live radio show. I'm your host, Anne Marie Cronin, and we are here tonight talking with Dr. Amar Katranji, board certified periodontist in Southfield, Michigan. The doctor is with us tonight discussing the latest treatments in periodontic care and the relationship between gum disease and many systemic diseases. If you have a question for the doctor on the topics we're discussing tonight, please call us at 800-859-0957. Dr. Katranji, over the break, we were talking about your office and what you're doing in your clinic, and you certainly have state of the art equipment in there. Tell us a little bit about your practice, your office, your clinic, and what you're doing there that no one else is doing.
Well, our focus really is on state of the art care for our patients. We like to treat people the way we'd like ourselves to be treated, our family members to be treated. And that requires us to constantly educate ourselves on what's out there, what's being developed, and then incorporate that into the office. Now, we use a very evidence based approach. So we'll go out there. Right now, we have lasers. Now, not every laser is the same. Some people have one laser, two lasers. We have 5 lasers in the office. So we will choose what's best for you depending on what we need to do for you, what the outcome is. We have a CT scan. We were one of the first offices in Michigan to have a dental CT scan. I personally worked on one of the first CT scans in the world at the University of Michigan. Our focus was, what's the best way to diagnose these patients? We use something called platelet rich fibrin, meaning we take your blood, we spin it down, and we concentrate the proteins that help with healing, and we incorporate that into every type of surgery that we do. We know that we're going to get a better result if we do this. So we're always looking to add and to improve what we're doing. And sometimes it's nuance. It's just the small things in surgery that make it better. Even though it might take us a little bit longer to grab that blood and spin it down, but adding it takes few seconds within the surgery and we get a much better result. So our focus is always on improving and in giving the best biologic outcome that we can.
I mean, that's pretty amazing. I would imagine, and I know that you've got a definite state of the art clinic there. I've always admired the fact that Dr. Nemeth is on the cutting edge of diagnosing the oral bacteria that causes something like 59 of the major diseases, heart disease, um, cancer, Alzheimer's, that if people knew about it and knew that they could go in, and if somebody go in and scrape the inside of your mouth and take a look at it, and then he's got this big, or you both have this big TV screen that's showing people the bacteria that exist in your oral cavity, people must just jump out of their chair.
Absolutely. And that's an important part of what we do. I mean, when you break it down, it's really bacteria that we're trying to fight.
Right.
And we, like you said, we take a swab, we place it under a microscope, and we study what we're fighting. We're trying to understand what kind of infection it is, and we learn from that how to treat it. And that's our focus. Again, it's not just, one size fits all, everybody gets the same treatment. It's tailor made to what's going on in your mouth.
And I've said all along that I think that if everybody knew that these diseases were preventable through early diagnosis, I just think that most of the listeners don't realize that all of the serious bacteria that causes all of the worst diseases of our time start out in the oral cavity.
Absolutely.
And we've had many doctors on the show, many medical doctors on the show that have attested to this, that, you really need to, as a patient, unfortunately, you have to be your own advocate, and you have to seek out where you can get this test done, where you can look at what is going on in the oral cavity, because there's no backtracking from Alzheimer's disease or from cardiac disease or from cancer. I mean, some of these horrible diseases, it's you get it and it's too late. You're stage 4, or you're the end of the line, or unfortunately, you die from it.
Right, and honestly, a simple way of looking at periodontal disease, it's a chronic infection. Imagine this bacteria is just living in your mouth and causing inflammation. These This bacteria gets into your system, and these inflammatory markers are just kind of going around your whole body, and they find themselves in your heart, in your brain, in your lungs, everywhere. So not to say that one will equal the other. You're going to have periodontal disease, you'll have other problems. No. But if you have other issues and you have cofactors, you will increase your risk to those diseases. And it's inflammation. It's just your body's reacting to inflammation. And the worst inflammation is coming from your mouth.
It's amazing because I would, lay a bet that all of the listeners out there, they go to see their dentist, they get their annual checkup, and if they need a filling, they get a filling, and if they need something done, with the tooth that's decaying, they get it done. But I don't think there is a connection, in spite of the fact that Dr. Nemeth thinks there is. I don't think there is. There's not a recommendation to everybody that's going to see their dentist. Go and have this test done to check and see whether or not you have the bacteria in your mouth that really needs to be taken out of there and eradicated forever before it gets behind the gum, as Dr. Nemeth has said many times on the show. Because once it gets up there in the roots of your tooth, it's gone. It's on its way to the heart, the lungs, the brain,
Absolutely.
whatever.
Yeah. Once it's in the bloodstream, it goes everywhere. And locally, what it's doing is it's destroying bone. And if you think of bone loss in any other part of your body, it's a problem. And really, the people again who are capable of treating this is going to be a periodontist. Now, what happens when you lose that tooth? What happens when you lose that bone? Again, a lot of times it comes down to replacement with an implant. And we've talked a little bit about complications and what we see on a daily basis. I've had patients come in where they've had multiple implants, and I'm taking these implants out, and now there's no more bone in the mouth. There's no more bone in the oral cavity. And one area that we're going to now is we're actually going to the zygoma bone in order for us to place an implant.
You're pointing to that. Where is that
It's
exactly?
it's basically the bone. It's kind of the cheekbone right underneath your eye.
Hmm.
And that's where we're going to place implants these days.
Hmm.
For patients who have no other solutions, we have an option, but it requires us to see them before it's too late.
And that's the question: is when is it too late?
Yeah. Unfortunately, when you can't talk, when you can't comfortably chew, you can't pronounce your words, you have a hard time just functioning. I mean, I had a patient tell me that he was depressed when he with his denture would not even fit on anything because what happens when you lose bone, you lose all those ridges for the denture to kind of hold on to. And putting adhesives on and all that only lasts for so long. And the chemicals and all that taste, it ruins everything. You don't taste your food, you don't feel comfortable talking to anybody, you lose that confidence. And he went to 9 different doctors, and every single doctor told him the same thing, "Can't do anything."
How is this possible? I mean, this is shocking to hear this, to go to 9 different doctors and be told you can't do anything. How is that possible?
Well, because it's such an advanced case. So, again, the specialist is gonna be the one who's gonna take care of those. That's what we do. And
Mhm.
those are the situations where we say, "Okay, we have a solution for you." And the solution isn't always easy, but there's at least something that we can do.
Well, I mean, I think that again, it comes back to the fact that, you've talked about patients that have gone to see 9 different doctors. That's incredible to think about. But again, I think that I have to put it back on the patient's shoulders. Don't just rely on your dentist to see you through what might happen after you leave your dentist's office. You need to really find out what's going on with your gums and make sure. I mean, do you see people on a regular basis that are just coming to you for periodontal checkups? Is that how it happens?
So yeah, I mean, there's still a lot of really fantastic dentists in town that will refer to us and send us patients when they're ready for treatment. When they see the signs of periodontal disease, they'll send those cases to us. We're the specialist, we'll take care of that specialty type procedure. And on a daily basis, we're looking at patients. All my patients, they have probe. They get probed. We look at the pockets. We take a look at the bacteria in their mouth. We're making sure that they're up to date with their periodontal treatment. And when they have implants, we're making sure to maintain those implants so they don't break down over time.
Very important to get the right care from the beginning. In the meantime, we're going to have to take a quick break. In the meantime, you are listening to the Dr. Amar Katranji live radio show. We're talking about the importance of being aware of the symptoms of gum disease and the latest treatments in periodontal care. If you have a question, you can reach the doctor directly by calling 800-859-0957. Again, that number is 800-859-0957. Don't miss this opportunity to talk to the doctor directly. You're listening to the Dr. Amar Katranji radio show on News Talk 760 WJR. And we are back on Facebook Live.
We're back on Facebook Live. I actually have a question relating to implants, and it might fall more into the realm of cosmetics. But here in Miami, it's a popular thing for people to go down to Colombia and get these smile makeovers. And I
Mhm.
believe what they're doing is like shaving off all your teeth. And correct me if I'm wrong, but they're doing these full makeovers where you come out with this new smile with all these implants. And I'm just curious, what are your thoughts on this, and maybe some of the dangers associated with it? Because it seems totally scary to me.
Yeah, so you might be talking about veneers. So a lot of
Okay.
times
Okay.
with veneers, if you have some teeth and they're crooked and you don't want to go through traditional orthodontics or Invisalign, there is a technique where people shave down your tooth. Now imagine you're taking away healthy tooth structure and you're putting a ceramic or something on the facing of the tooth. One of the things that we see from those is they pop off all the time, or let's say they over prep and they create, when I say prep, when they're actually removing parts of your tooth, there we call that a prepping your tooth. And you don't have a perfect fit sometimes with that veneer on top of the tooth, and you have these little voids between the tooth and that veneer. Well, now that is a perfect place for bacteria to occur, to invade and create problems. So veneers are great. And I don't know what the practices are in Colombia or anywhere else outside the U.S., but you typically want somebody who's done these before, who's going to do a good job, who's going to use a good lab, and have the vision to give you something that's aesthetic and what you're going to be happy with.
Okay. Yeah, interesting. I've just seen it. It seems to be popular here, but it seemed like almost impossible, some of the results. So I was just curious. We do have another question on the Facebook Live, by the way. If someone has gum disease, do they start losing bone right away? How long does it take before you start to lose bone and teeth?
So the way that gum disease progresses, the first step is gingivitis. So let's say you take a bite of an apple and you don't brush your teeth for a few days, you'll start to see some inflammation. Your gums will actually swell up. Okay. So that swelling is just gingivitis. Gingivitis is reversible, meaning if you brush, floss, see your hygienist, it's going to go away. Now, let's say you don't do anything and that bacteria starts to work its way down that pocket because now the tissue is up. The bacteria starts to go deeper and deeper, and it's harder for you to get at home. Then you start to get swelling of that, not just the soft tissue, but the bone starts to dissolve. The reaction from the bacteria actually causes the bone to dissolve. And that's the first sign of what we call periodontitis, which is when it starts to impact the bone. So Not all cases of gingivitis, or none of the cases of gingivitis is when bone hits, but all cases of periodontitis or periodontal disease is actually bone related.
Okay.
It's interesting, isn't it? I mean, it's amazing what people don't know as far as dental care. Like, you're in Miami where it's all flash and trash down there. And
Well, the thing is, so much of it's invisible, like you might not have symptoms that you feel or notice. I mean, it's microscopic organisms.
Right.
So, and, I'm in my 30s and I've never seen a periodontist. I don't know if I should, but it's just you go to your dentist and you hope they'll tell you if you have something wrong with your gums and then you take it from there. But maybe a lot of people ought to investigate it more often and earlier.
Yeah, what's critical is you feeling comfortable that your dentist is looking at things and diagnosing things. And like I said, it's a probe. It's that little measuring device, that ruler that we use. That
Mhm.
is honestly going to give you so much more information. So if they're not using that, then you probably should go somewhere that is.
It's a good tip.
Yeah, but most people unfortunately don't know. That's the problem. You just rely on your general dentist and they're like all about, checking out your annual examination, taking x-rays and then seeing where you need a filling and or a root canal, and then you're out the door and nobody's ever said anything to me about if your gums bleed, there's something wrong. And I guess they wait until after the disease has taken place. But anyway, welcome back to the last segment of this special live edition of the Dr. Amar Katranji radio show. I'm your host, Anne Marie Cronin, and we're here tonight talking with Dr. Katranji, board certified periodontist with Nemeth and Katranji Periodontics in Southfield, Michigan. He's with us discussing the latest treatments in periodontic care and tooth replacement. This is our final segment. So if you have a question for the doctor on the topic we're discussing tonight, please call us at 800-859-0957. Dr. Katranji, one of the questions I have for you is, you see a lot of advertisement on television about in and out in one day, we can replace all your teeth. Is that possible? Is it, can you do dental implants on the entire mouth and then people go out with a dental implant? It's just like having their own teeth.
Sure. I mean, the short answer is yes. I mean, we can absolutely replace your teeth in one day. The longer answer, of course, is it depends. What you have, what's the situation? Many times people come in, if you're in a denture, you need to have replacement. That's something that we can do in a day. Typically, we're placing implants. You're going home with teeth that are fixed. They're no longer removable. So going from a denture, basically a cripple, you have something covering the roof of your mouth, it's gone within the day. Okay. If you have somebody who comes in and they have multiple abscesses, meaning infections, and they have teeth that the soft tissue or the gum tissue isn't healing up right, the first thing you have to do is clean it. You have to make sure that things get healthy before you start placing implants. Even though you're removing the teeth that are coming, they're coming out and they're getting replaced, you still want to make sure you don't have active infection all over the mouth. And that's where a lot of these cases kind of go the wrong way is they just want to push the envelope just to get you in and out. And that's not the right way to do these types of cases sometimes.
Now, I mean, to the average listener or to the patient who is facing this type of dilemma about tooth replacement, that's something that they don't know about. They don't know about the fact that you need to take care of the underlying disease, get rid of the bacteria, because there's no point in putting in replacement teeth if they're going to be eroded or there's going to be damage or they're going to have to get it done all over again. How many patients are you seeing on an ongoing basis where it's a redo?
So I would say a bigger and bigger part of my practice is implant complications. So typically, I would say 20%, 25% of my practice has something to do with issues that happened in the past with implants, and I think that's growing. That segment of the population is growing because of these advertisements, because of these, kind of, rush to do things. Now we have the capabilities to do things all in one day, but that doesn't necessarily mean everybody gets it done in one day. So we want to make sure that we do it right. We want to make sure that when this implant is placed, you're going to have it for a very long time and in a way that you're comfortable and happy.
Yeah, I mean, the important thing is that you don't want to get yourself into a situation where you rush to fixing something only to find out that later down the road it's going to have to be undone
Right.
and redone.
Right. And it's much more difficult to redo these cases. A redo is much more time consuming for a person. It takes a lot more effort. Sometimes it's multiple procedures before we get you to a point where you were before.
I mean, are you confident that pretty much everybody who would call your office or come to see you, that you're able to resolve their issues when they've probably gone down the wrong road and they're suffering from, having what I want to call a bad job done? And
Absolutely. Absolutely. I think we feel very comfortable and confident with almost every single situation. We have just about everything at our disposal. We work with some of the best people around, and we really, really treat everybody as if we're treating ourselves or our family.
so I mean, this is obviously our last segment. What advice do you have for the listener out there that we may not have covered? What would you like to talk about in this
Honestly,
last
the
segment?
biggest thing is asking questions, and you bring it up very well. How do people know? How do you know you're getting the right care? And information is everything. There's a lot of information out there, and then really just asking questions. When you're sitting in somebody's chair, there's nothing wrong with asking, "Hey, what do you think of this? I read this. What do you think about this procedure?" There's nothing wrong with having those questions answered. So if you have a concern or if you're in a position where you have a long-standing relationship with somebody, they should have no issues with you asking a question about your treatment. And I think that's important, is that knowledge is very important, especially with your oral health.
So you're saying that people should talk to their dentist, their primary care dentist, first of all, about, other issues that they may have or about their oral health in general.
Absolutely. Hey, a simple conversation. I'm concerned about my periodontal health, my gum health. I heard a program on the radio,
Mhm.
and my concern is sometimes I see bleeding on my toothbrush. Why am I getting bleeding on my toothbrush? What are we doing to improve that? And that is a really good segue into different ways of treating that issue.
Well, I know that you certainly have a very, state of the art clinic, and you do a lot of stuff, and you've certainly got the top quality equipment in your office, and the number of lasers that you have, and the procedures that you're doing are way ahead of the curve. But I still always come back to the fact that I just think everybody should be calling the periodontal office and saying, "I want to get in to find out whether or not I'm carrying any bacteria in
Right.
my mouth."
And that's where we start. Our goal is to remove the bacteria, to save the teeth, to get you to health. We're not interested in taking teeth out. We're not interested in doing anything that's not necessary. But once we have the diagnostic tools and we know what's going on, let's say you have a gummy smile, we can help you with that. Let's say you have recession, we can help you with that. Those are things that happen after we've taken care of the bacteria.
But
We,
they're all things that were initially caused by bacteria, by gum disease. They were all initially caused by bacteria.
in some cases, yes.
Mhm.
In some cases, it's a genetic issue. Some cases, somebody was born with very thin tissue. We call it a thin biotype. So some people are born with certain conditions, but we still treat the disease first. Always disease control, very first thing. Making sure that somebody has the ability to brush and floss and get to the bottom of their pockets, and then on a program where every 3 to 6 months they're getting their teeth cleaned. They're getting their gums rinsed and washed, and all that bacteria is being. I always tell patients it's like a reset button. You're pressing the reset button every 3 months and getting rid of all that bad bacteria. And that bad bacteria is going to come back. And it takes about 3 months. And the reason why we bring people back at 3 months is because there are studies that show the most aggressive bacteria after they've been removed tend to show up at the 3 month interval. So if you come in every 3 months and you have your maintenance, meaning you get your cleaning, we'll be able to maintain your teeth for a very long time.
And once again, coming back to something that your partner, Dr. Nemeth, talked about once before on the show, is that you have a very aggressive way of killing the bacteria so that they're dead so that it's actually eradicated from your mouth. And it's not just, a lot of people will say, well, I floss and I cleanse my mouth out. That doesn't work. Normal mouthwash doesn't work. So
Right.
people can't think that if they just go and buy mouthwash that it's going to kill the bacteria that's in their mouth. So again, I think it's incumbent upon the listeners to get in touch with an office like yours, Periodontal Care, and find out where they stand. Let's get a baseline going.
Absolutely. So, and that to your point, if I'm brushing and flossing at home, my ability to clean is about 1 to 2 millimeters below the gum line. 1 to 2 millimeters, no matter what I use. If I use Listerine, if I use floss, if I use the latest and greatest, water pick, it's all going to be 1 to 2 millimeters.
All right. Well, unfortunately, we're out of time, and that wraps it up for the Dr. Amar Katranji radio show on News Talk 760 WJR, sponsored by the North American Society of Periodontists. I'm your host, Anne-Marie Cronin, and again, I want to thank Dr. Katranji for talking to us this evening about taking charge of our health, being proactive, and avoiding the devastating results of undiagnosed periodontic disease. To learn more about Dr. Katranji's periodontal practice, you can reach him directly at 248-357-3100. Again, that's 248-357-3100. Or by visiting him on the web at drnemeth.com. Again, that's drnemeth.com. We hope you enjoyed this special show and that you become more informed about periodontal disease and its impact on the major diseases of our time. And thank you for listening.